Kadian is a medication used to help relieve severe ongoing pain, such as pain due to cancer. It belongs to a class of drugs known as opioid analgesics and works in the brain to change how your body feels and responds to pain. It is important to note that the higher strengths of this drug, 100 milligrams per capsule and higher, should only be used if you have been regularly taking moderate to large amounts of an opioid pain medication. Using these higher strengths without a tolerance to opioids can cause overdose, and even death. It is also important to remember that Kadian should not be used for mild or short-term pain relief. This medication is not for occasional, as needed, use. Always follow your doctor's instructions and take the prescribed dosage at the recommended times for the best results. Before you start using Kadian, make sure to read the medication guide provided by your pharmacist. Take this medication on a regular schedule as directed by your doctor, usually once or twice daily. It can be taken with or without food, but if you experience nausea, taking it with food may help. Swallow the capsules whole, but if you have trouble swallowing, you can carefully sprinkle the contents on a spoonful of soft, cool applesauce. The dosage is based on your medical condition and response to treatment, so do not increase your dose without consulting your doctor. If you are giving this medication through a tube into the stomach, ask your healthcare professional for detailed instructions. Before you start taking Kadian, ask your doctor or pharmacist if you should stop or change how you use your other opioid medications. Suddenly stopping this medication may cause withdrawal, so it's important to follow your doctor's instructions. Additionally, Kadian may sometimes cause addiction, so take it exactly as prescribed to lower the risk. Remember to tell your doctor if your pain does not improve or if it gets worse. Some common side effects of Kadian may include nausea, vomiting, constipation, lightheadedness, dizziness, or drowsiness. These side effects may lessen over time, but if they persist or worsen, it's important to consult your doctor or pharmacist. To prevent constipation, it's recommended to increase your dietary fiber, drink plenty of water, and exercise. You may also need to take a laxative, so it's best to ask your pharmacist for guidance on the right type for you. To reduce the risk of dizziness and lightheadedness, it's advised to rise slowly when getting up from a sitting or lying position. It's important to remember that this medication has been prescribed to you because the benefit outweighs the risk of side effects for you. However, if you experience any serious side effects such as interrupted breathing during sleep, mental or mood changes, severe stomach or abdominal pain, difficulty urinating, or signs of adrenal gland issues, it's crucial to inform your doctor immediately. Seek medical help right away if you experience very serious side effects such as fainting, seizure, slow or shallow breathing, severe drowsiness, or difficulty waking up. While a severe allergic reaction to this drug is rare, it's important to seek immediate medical attention if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects, so if you notice any other effects not mentioned here, it's best to contact your doctor or pharmacist for guidance. Remember to consult your doctor for medical advice about side effects, and to report any side effects to the appropriate health authority in your country. Kadian is a medication that contains morphine, which can be addictive and may cause breathing problems. It's important to take the smallest effective dose for the shortest time possible to lower the risk of abuse, overdose, and death. Your doctor can also advise if you should have naloxone available to treat opioid overdose, and it's important to know the signs of an overdose and how to treat it. When starting Kadian or after a dose increase, there is a higher risk of severe breathing problems. It's important to avoid alcohol and other drugs that can cause drowsiness or breathing problems while taking Kadian. If you experience slow/shallow breathing, lightheadedness, severe drowsiness/dizziness, or difficulty waking up, seek medical help immediately. It's crucial not to crush, chew, or dissolve the medication, as this could cause a fatal overdose. Keep Kadian in a safe place to prevent theft, misuse, or abuse, and seek medical help if someone accidentally swallows the drug. Women of childbearing age should discuss the risks and benefits of Kadian with their doctor, especially if they are pregnant or planning to become pregnant. Using Kadian during pregnancy may slightly increase the risk of birth defects or cause withdrawal symptoms in the newborn baby, so it should only be used when clearly needed and in the smallest effective dose for the shortest time possible. Before taking Kadian, make sure to inform your doctor or pharmacist if you have any allergies to morphine or other opioid pain medications. This medication may also contain inactive ingredients that could cause allergic reactions or other problems, so be sure to talk to your pharmacist for more details. It's important to share your medical history with your doctor or pharmacist before using Kadian, especially if you have brain disorders, breathing problems, kidney or liver disease, mental/mood disorders, or a history of substance use disorder. This drug can make you dizzy or drowsy, so avoid alcohol or marijuana while taking it, and do not engage in activities that require alertness until you can do so safely. If you are an older adult, you may be more sensitive to the side effects of Kadian, including confusion, dizziness, drowsiness, and slow/shallow breathing. It's important to talk to your doctor or dentist about all the products you use before having surgery, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use Kadian if clearly needed, as it may harm an unborn baby. It also passes into breast milk and may have undesirable effects on a nursing infant, so be sure to consult with your doctor before breastfeeding. It's important to be aware of potential drug interactions with Kadian, as they can affect how the medication works and increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Kadian include certain pain medications, naltrexone, and samidorphan. The risk of serious side effects may be increased if Kadian is taken with other products that may cause drowsiness or breathing problems. Make sure to inform your doctor or pharmacist if you are taking other opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's also important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. This medication may also interfere with certain lab tests, so make sure lab personnel and all your doctors are aware that you are using Kadian. If someone has taken too much Kadian and they are experiencing serious symptoms like passing out or difficulty breathing, it is important to give them naloxone if it is available and then call 911. If the person is awake and not showing any symptoms, you should call a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of a Kadian overdose may include slow or shallow breathing, a slow heartbeat, and coma. It is important to seek help right away if you suspect an overdose. Remember, it's important not to share Kadian with others as it is against the law. This medication has been prescribed specifically for your current condition, so do not use it for any other condition unless directed by your doctor. If you need a different medication for another condition, your doctor will advise you accordingly. If a dose of Kadian is missed, take it as soon as you remember. If it is close to the time for the next dose, it is best to skip the missed dose and take the next dose at the regular scheduled time. Do not take a double dose to make up for the missed one. When it comes to using Kadian, it's important to store it at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and out of reach of children and pets. And remember not to flush it down the toilet or pour it into a drain. When you no longer need the medication or it's expired, make sure to properly discard it. You can find more details in the medication guide or consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.